Kenya Medical Supplies Authority after the chairperson of the board, Mary Mwandime, announced redundancy that will see non-core staff work from home for 30 days as the authority restructures for effective delivery of service. The move by KEMSA has attracted mixed reactions from senators and health unions who have condemned the move.
It is the government's main agency tasked with the supply of drugs and medical supplies. But its sick state got the government and some international partners worried sick, culminating in a massive layoff that will see at least 900 staffers lose their jobs.
At KEMSA, we don't have a union, so it's bad for us. We don't have a union. So hakuna mtu atatutetea. Ni sisi wenyewe tujitetee.
The authority's chair, Mary Mwandime, announcing raft of measures she says will streamline its operations. Some of the affected departments include warehousing, procurement, and supply chain department.
As the review gets underway and in compliance with the legal requirements governing labor management, the board has issued general notice letters to all staff working with KEMSA this morning.
The move, according to the chairperson, was reached at after a decision made by a multi-agency task force that was formed early in July and which included international partners counterparts like the World Bank and Africa Resource Center.
It's a plan to reorganize the organization so that we meet our mandate, which is the procurement, the warehousing and distribution of a very, very vital item for the Kenyan people, which is medical supplies.
But while the task force saw it fit to prescribe that kind of antidote to rid KEMSA of its rot,
Madam Speaker, as a Senate would not care about KEMSA.
Senators who were discussing the reforms at the Medical Supplies Authority were reading from a different script.
That 900 ordinary junior employees within KEMSA are being sacrificed at the altar of protection of powerful individuals within government and within KEMSA fraternity, Madam Speaker.
Kembe Gitura, who used to sit here, was given another job instead of answering questions. It is a cover-up.
When you decide to sack 900 workers, that is a whole institution. And there must be something really that is warranting sacking of all these members and workers. Honorable Speaker, I condemn the act of sacking 900 workers.
Yes, could be these particular people, maybe their duties are no longer very seriously needed, but there are significant people behind these particular 900 people.
The Kenya Medical Practitioners, Pharmacists and Dentists Union have also called on KEMSA to suspend the purported restructuring to allow for further engagement of stakeholders, including unions and professional associations. As the reforms take effect, the National Youth Service is one of the government bodies that will take control of operations at KEMSA as policy structures are being initiated.
The core operating teams and our caretaker management team have been notified, appointed, and mobilized to ensure seamless operations in the intervening period.
Joash Onsare, TV 47, Nairobi.